That's a question that we still get even at this time period. Really, the vaccine is the very best way we can protect ourselves against hospitalization, against long COVID, and against death. And so it's so imperative that we encourage everybody to get vaccinated. It's your best insurance card that you can possibly have. Vaccine hesitancy is obviously still a problem. We have so many people that have chosen not to get the COVID-19 vaccine. And really, vaccine hesitancy is never just one thing. It's usually multifocal. A lot of times it is because you have decreased thought of the safety and efficacy of the vaccine itself, or you don't trust the people who made the vaccine or the government or the process of making that vaccine. So those are some of the origins of vaccine hesitancy. And really, the best way to address vaccine hesitancy is to first listen. Listen to what the person is concerned about. Often their concerns can be really valid. And so then we really want to take a deep breath and make sure that we're engaged with this person in this conversation. And then answer their questions honestly. Take the time to honor the fact that they're engaging with you. A lot of times when we talk about vaccines, people don't want to have the conversation anymore. So if someone is taking the time to actually talk with you about what they're concerned about their fears, make sure you make the time to listen and respond respectfully and thoughtfully, and just really be honored that they're engaging. Right now, boosters are really imperative, and we have data to show why. We know that certainly after 5 months, that our antibody levels are lower, but the further data shows that not only do antibodies levels go down, but that breakthrough infections and hospitalizations and poor outcomes go up, especially among our patients, among the elderly and geriatric patients, people who have comorbidities. So we know this to be true, and especially with Omicron, we know that booster shots are really effective, that we can increase our protection from 20 to 30% back to 80%. And so our protection level with booster shot is substantial. It can save your life. Yeah, that's a great question. The questions and concerns have changed in different aspects and different timing during the pandemic. Right now, the questions I get are about booster shots. Why is it that staff really, the uptake of booster shots is not what we were hoping it to be? And what are the barriers there? What is the thought process there? So when I talk to staff and residents, the 3 top reasons why people are not getting their booster shots are, I don't really need it, I'm already fully vaccinated, or everybody's going to get COVID anyway, why should I get a booster? Or the side effects after that second messenger RNA vaccine really knocked my socks off, and I really don't want to have that happen to me again. So I think it's important to address all 3 of these reasons why people aren't getting their boosters. In terms of, well, is it really needed? We've just even talked about the data that shows that your protection against COVID-19 without a booster, especially with Omicron, is really not enough. And so you need a booster to protect yourself. Boosters and no vaccine makes you bulletproof, but it really protects you to the point that you can decrease your risk of having a bad outcome from COVID-19. In terms of everybody's going to get COVID, why should I bother with a booster shot? I'm always reminded about a story that an infectious disease doctor had told me, that we used to have chickenpox parties, and that everybody wanted to get, have their children get chickenpox. But some of those kids had poor outcomes, that they ended up getting chickenpox, but then they actually ended up in the hospital. And so you never know. If everyone's going to get COVID-19, we hope you do well, but you can't be really sure about that. Some people don't do well, and getting a booster shot is your insurance card to increase your odds of doing well. So don't take that risk with your health. And in terms of side effects, I always talk to people about, yes, there can be side effects. It's usually for a day. Now, if you get COVID-19, of course, you have to isolate for 7 to 10 days. So in terms of missing work, putting your family and residents at risk, really it's worth going through the booster shot, even if you might have some side effects for a day. So those are the reasons I give. You know, it's funny, I have seen both sides. I've seen that both facilities and patients and staff are combining. So they're like, okay, I'm gonna get my booster shot and I'm gonna get my flu shot. I'm gonna do it on the same day. And it's kind of a thing, which is lovely. And I think that vaccine hesitancy have had people also say, I'm not going to get the COVID-19 vaccine and I'm not gonna get my flu vaccine or other vaccines. I do think that with AMDA being awarded the CDC grant for immunization and to study this and to promote it, it's an opportunity, again, for us to have these discussions. I think that these vaccine conversations open a door, and I hope we all walk through it, to start building these trusting relationships. You first start talking about your concerns about vaccination and other concerns, and then you start having a better and trusting relationship with staff members, with family members and residents. And that can lead to goodness down the road. Then you can talk about antibiotic stewardship, or you can talk about fall prevention. And so I hope that these vaccine conversations really lead to further improvement in post-acute and long-term care.